So depending on what the sleep disorder is,
Okay.
so let's say it's chronic insomnia and someone goes through cognitive behavior therapy.
Yeah.
If it's just, if it's not chronic insomnia, but it's, hey, how do I, tweak some stuff through my behaviors? You can notice something immediately, truly.
Yeah.
I mean, really with anything we do, you can notice benefits really quickly. Cognitive
Okay.
behavior therapy typically is a 6-week program. So it's actually, and the results often just maintain, which is the best part of it. It's
Yeah.
incredibly effective. It's really just getting someone to say, I'm going to agree to, essentially change my behaviors and my habits.
Yep.
A lot of the things we do around sleep is a lot of habit and behavioral changes, and it's really hard. Like we're really not good as we get older in changing habits.
Fair.
I will say, again, I can use me as an
Yes.
example of this, and you've got to be able to say this is like a job. Like I am going to make the effort to do this, and part of that matters on why someone comes in the door. So I will say if someone comes in the door because like, I'm raising my hand going, I don't feel good. I
Yep.
know I have these issues and I need help versus someone told me I had to come here. And that can make a difference on how motivated someone is to make the changes.
Yep.
But if they do it, you can find benefit really quickly. That's the best part about it because,
Okay.
and I always talk about short-term and long-term implications to sleep. In the short term, when you're not sleeping well, it can manifest itself in different ways. It may be, I can't sleep at night. My sleep is restless. I'm waking up. I feel tired in the morning. I have brain fog, or I'm hitting snooze for 2 hours.
Losing weight, gaining weight. Yeah, like-
All of exactly right. Like I look at food differently. Often it is I'm gaining weight and I don't know why. My blood pressure and blood sugar are a little bit high in the morning per my doctor. I'm feeling really sluggish and fatigued. I'm really having a hard time focusing. It could be so many of those different things. Or I'm irritable, I'm on edge, I'm really struggling with these feelings, or I'm driving on 400 and I'm feeling like I'm going to nod off when it's trafficy.
Yeah.
It could be any of those. And often you really get a benefit in those pretty quickly. And
Okay.
what we find is that, if someone can feel like, yeah, this is making a difference by me treating my sleep, what I came for got better. And then what I would tell people, I was like, if I can get you better in the short term, when we treat your sleep, it has long-term implications. Because when you don't sleep well, you do increase your risk of weight gain leading to obesity, of high blood pressure, of diabetes, of heart disease, stroke. I can name on and
Everything,
on.
yeah.
Literally, sleep impacts every part of our body. And definitely if you have genetics there as well, which is where it's really good to get the family history, you put your risk at those different things depending on what is going on in the family. And often they may have a sleep disorder as well that may not have been addressed.